Welcome, everyone. We'll get started in approximately 5 minutes. Welcome, everyone. We're going to give everyone just one more minute before we get started. Thanks for joining us today. Welcome, everyone, and thank you for joining today's RBMA webinar sponsored by CCD Health. Today's topic is preventing revenue loss through improved patient access. Our description today is optimizing patient access in today's competitive healthcare landscape is crucial for preventing revenue loss and improving overall financial performance. This webinar will explore innovative strategies to enhance patient access processes, focusing on effective scheduling practices. In this session, we'll discuss how the collaboration between healthcare management solutions and specialized patient communication services can significantly impact your organization's performance. Attendees will gain insights into cutting-edge technologies, best practices, and practical solutions that can be implemented to enhance patient satisfaction, improve operational workflows, and optimize revenue potential. As a reminder, today's webinar is being recorded and will be made available 24 hours after the session concludes via email. Please share any questions here in our chat or the Q&A. Our speaker, Edison Sepulveda, will be answering them throughout our webinar today. Edison, if you want to move on to our key learning outcomes. Oh, and introduce yourself, please. I don't want to.
Yep. Thank you, Megan. Very quickly, my name is Edison, and I work with product at CCD Health and innovation. My background is a bit of a combination of both technology and financial skills, which allows me to talk very extensively on this topic for today. So looking forward to sharing some insightful insights with the audience.
Awesome. And then our learning outcomes for today. After the webinar, we'll hope that you'll all be better able to identify and address patient access challenges, evaluate financial benefits of improved access, explore innovative technologies for streamlining operations, and implement patient-centric approaches in healthcare workflows. Edison, take it over. It's all on you.
Thank you, Megan, again. And as you mentioned, what we want to cover today is what is this interaction between all of the workflows that you cover in patient access in your center radiology group with how you have that well-oiled revenue generation engine for your radiology group or your radiology center. And this entails a lot of steps throughout the process that we're going to be covering. The idea is to give you both what are some of the challenges that we have seen working with local, regional, and nationwide radiology groups, as well as what are some of the solutions that we've seen work best to address some of these common challenges that you may face. And one of the key learning outcomes that we wanted to communicate is how in each step of the process of your patient access process, there are challenges that you need to tackle and you need to understand. Over the couple of next slides, we'll be communicating as well some of the benchmarks that we have been able to extract from working with these radiology groups that will serve you to understand if you're doing better than the market or if you need to improve based on your comparison to the market. Now, as you know, there are many steps of what we call patient access, right? From the moment you get, especially for outpatient radiology groups, from the moment you get that referral from your referring physician, that you need to process that order. Some of the radiology groups we've worked with call them labeling, scanning, but however you call it, you need to process those orders that typically come through faxes or other more automated channels, and then go through all the hoops of the appointment scheduling, appointment confirmation, all the check-in and registration, and then what we call the encounter or the exam, plus the follow-up. All these different steps in the process is what we call patient access. So we'll be focusing on that and also touching on how that translates into potential issue, even beyond that, where you're doing your whole revenue collection and revenue cycle management process. Now, some of the most impactful that we've seen are related to appointment cancellations. We're going to spend a lot of time on that. And then the insurance verification and how it impacts both your collection at the point of the encounter or your denials management and claims management with the payers. But going into at these steps in the process, what are some of the things that we see that actually hurt your potential for revenue generation? And even before I go into that, I want to define revenue generation or the revenue generation engine, because most of the time we focus, and especially I've seen this across different industries with different people in finance, that we pay more attention to what are the financial costs. So this is costing me X, and not pay enough attention to what is my opportunity cost. I'm not generating this amount of revenue because there is something that I'm not doing. And this is, for most of the centers, this is even more impactful than whatever the financial costs of that you see from having a particular process. So what are some of the common challenges that we see specifically related to missing on those opportunity costs? First is inefficient appointment scheduling. And how this translates. What we've seen is that this inefficient appointment scheduling, and mostly through issues with lack of proper administrative workflows, lack of proper controls to go through that appointment scheduling, can lead to anywhere from 4% to 8% of your total cancellations. And this may be due to a variety of reasons. It could be that the center selected for the appointment was not the proper center for the patient. It could be that there are some issues with the alignment on the system between what is working and what is not, but also some issues related to things like the proper exam selected and many variety of reasons. Proper preparation procedures for those patients. And that leads to a different array of issues, from overbooking when you're not doing a proper selection of booking your time slots, underbooking when you're not maximizing, especially using those first available time slots that you may have for your center, or just missed appointments due to some of the reasons that I just alluded to. Again, this could range from 4 to 8% of your total cancellations. Then there's and this is during the encounter process. One of the most pervasive issues and one of the largest opportunity costs for many radiology groups is what we call no-shows, right? People who schedule an appointment and then never show up to set appointment. This leads to significant revenue miss. We could go into the millions of dollars for a center. Typically what we see is, besides the missed revenue, which is significant, you also see significant underutilization of your high fixed cost asset, which are your MRI machines, your CT scans, etc. We'll discuss as well some of the potential solutions that you can implement right now in your center that will address no-shows and cancellations. And last but not least is everything related to insurance verification and authorization hurdles. And what we see is that out of your total cancellation base, usually we see that on average, 23% are related to insurance authorization issues. And as we're gonna see later, even more than that, in the millions of dollars for a mid-sized hospital or a mid-sized center, could be to RCM issues. Let me know if you can still see my screen, sorry.
Yeah, Edison, I think we might have lost you there for a sec. Oh, there you go.
Okay, am I back?
A little choppy, but there we go. I'm seeing you.
Okay, apologies for
And
that.
then I'm going to pause you really quick. As you were talking, we had someone pop into the chat
Okay.
with a question. Juan Gomez asked that he's glad to see you. What do you think is the most optimized strategy to manage scheduling, overbooking, or underbooking, specifically with high cost modalities as CT and MR?
That's a great question. What we have seen is that if you overbook using let's call it an unsophisticated strategy, you're gonna affect the patient experience. But if you underbook, then you're missing out on potentially maximizing that revenue generation engine that we discussed. So we have seen that you can strike a great balance by using some of these new age machine learning and AI techniques, especially something that we're going to discuss, which is the no-show prediction model, in which you can use some type of confidence intervals to understand what's the ideal approach and what's the ideal strategy to overbook, meaning that you don't affect your whole appointment base, but you target only those that are more likely to become no-shows. So that's what we've seen is the ideal strategy to both strike that balance between that patient experience, but also maximizing the utilization of those high cost fixed assets that you have. Okay. Hope this answers the question. If not, feel free to shoot a follow-up question. And going into the third component, the third, let's say, key big item in these common challenges that we are going to be discussing is related to the insurance verification and authorization hurdles. I mentioned already that 23%, close to 23% of the total cancellations that we see are related to auth not being processed in time or the auth being denied. This is a huge issue, and that comes back to scheduling, because it might be that you didn't schedule the appointment with the proper time frame to complete the authorization. But it can go the other way as well, and this is difficult to identify, but there are some exams and some procedures that require a shorter lead time to process that authorization, or even that don't require authorization at all, but you are asking your schedulers to still schedule them 3, 4, 7 days to allow your authorization team to process those appointments. That's also translating into an opportunity cost, because you could potentially schedule those and fill those time slots that you already have available in the near future. And we're going to touch on how to address that as well. And the other key component that we've seen, besides that 23% related to auth, it's that for many of the radiology centers that we've worked with, there's a significant discrepancy between what they can actually collect from patients at the point of encounter, if they're doing a proper insurance verification and benefits estimates, versus if you're not doing it properly. What we've seen is anywhere from 58 to 60% for those that are not necessarily doing this process properly, that it's able to collect from patients at the point of the encounter. But that increases significantly on average based on what we have observed, to more than 80% for those that at the point of the appointment scheduling are providing proper information on out-of-pocket expenses to some of their patients. So using proper tools to provide that the information at the point of the scheduling or right after that could significantly increase what you can collect from patients for those out-of-pocket expenses that you need to communicate. So those are the ones that we're going to focus on, but we're going to touch on what are some of the others that we see, and what is somewhat of a ranking based on what we have observed over this plus than a decade. I'm not going to touch on all of these, since you already know most, if not all, and how impactful they are for your business in particular, but I want to pay attention to a couple of these. Obviously, coding is one that it's significant financial cost for many centers and many healthcare providers, and radiology specifically is suffering a lot from coding issues. And the high denial rates. And I'm going to present a case on how patient access can impact the denial rates that you see on a daily basis. So bear with me on this, because this is going to be very interesting. Then I wanted to focus on a couple of things. First, as I mentioned, and if you see number 6, the low utilization of your imaging equipment. Because as I mentioned before, as financial people, we typically focus on what are the financial costs, how much I'm paying for X, how much I'm expending on X, but not paying enough attention to those opportunity costs. And this is one of the most impactful ones that we've seen across the board for radiology groups. Because if you add up cancellations plus no-shows, that could mean that you're losing anywhere, based on what we've seen, from 13 to close to 21% of your total potential revenue. Meaning up to 1/5 of your revenue could be going out the door just because you're not paying enough attention to this opportunity cost. And usually you won't be able to recover all, but at least if you're able to drop that 21% to around 5 to 7%, which is the ideal range that we've seen, is significant for your business. And it's going to translate, obviously, not only into your top line, but also into your bottom line. And another one that I wanted to focus on is the inefficient workflow management, because many of the times what we've seen is that there's not necessarily a proper communication between whatever is patient access and then the revenue cycle management component. And that translates into the RCM team being able to process denials and increasing the size of the teams to manage those denials, but then not going back to whatever is the root cause of those denials to understand how we can fix those at the root cause, which will increase significantly both our potential for revenue collection, to increase that revenue recovery, but also to address the issue of denials that impacts severely the cash flow. And if you talk to your CFO, one of the most significant issues that you may have is right the amount of AR that you may have with any payer in particular. So by addressing issues at this point in patient access, you'll be significantly impacted how soon you can collect those cash flows from the payers, and also reducing significantly those denial rates. But we mentioned that we want to touch on not only what are some of the problems that we've seen, but what are some of the innovative strategies that these radiology centers that we know of or have implemented to address these issues. And I'm going to touch on each of these very briefly. Again, if you need more information, we can touch afterwards, or feel free to ask a question. For coding and billing, one of the most impactful strategies that we have seen is the use of these new age AI assisted tools that can really impact significantly the turnaround time for those charts, to be able to process them faster and more accurately. And the technology is improving to where we can see anywhere from north of 95% accuracy and north of 65% direct to billing, which is significant for how soon you can collect and how, obviously, how can you minimize those denial rates. For the denials management, one of the most impactful things that we have seen is being able to really deep dive into your ATV report, that age trial balance report that you see, is how you can have proper dashboarding tools, a proper team to do the analysis that is required on those ATV reports to understand what are the sources of denials. Again, many of the radiology groups that we've seen focus a lot on how we manage denials and not enough on how this denial management can help us address the root cause of the issue, which is very typically inpatient access or coding. Payer negotiation is something that we're not going to spend a lot of time on, but we've seen a lot of miss or underpayments due to this. And a key component here is how are you able to understand what's billable and if you have some revenue leakage versus your contract. And we have seen the centers that do it better are implementing, again, this new age tool. AI, has solved a lot of issues across the board. But one use case in particular is contract management, where you can implement some type of AI tool that can analyze your contracts to collect some of the terms on those contracts and make sure that you're adherent to whatever are in those contracts. And that summary of the terms really helps any RCM team to be able to identify things or items where they might be under collecting or under billing, which can be, again, in the millions of dollars for a mid-sized center. For patient scheduling and no-show, I already mentioned one of the things that is really impactful is how you strike that balance between no-shows, managing the no-shows, but also having a proper patient experience. And this is where, again, machine learning and AI can come in with a no-show prediction tool. You can understand from your appointment base which are more likely to no-show, and then you can implement strategies like how do I overbook? Can I overbook just those time slots where I have an appointment that is more than 80% likely to become a no-show? Based on things like patient previous behavior, patient demographics, and also some of those variables that really impact the potential for no showing. Streamlining the processes across the board, and some of the things we see here is the fragmentation of technology, where you may have a different technology for order processing than one for appointment scheduling, and then another one for insurance verification, and that one can be the same for insurance authorization. But then you have another set of tools for RCM. If you don't have proper integration between these set of tools and technologies, usually what ends up happening is that you won't have a streamlined process unless you have a really good communication among those teams, which is harder to achieve, to be honest. So one of the things that we typically have seen work here best is to try to streamline the technology as much as possible through interfaces between the tools, but also trying to improve those communication frameworks across the different departments and different teams that work on the patient access front and also the RCM front. We already touched on the low utilization of equipment, which touches on as well on that no-show, and how you can optimize your scheduling processes. And then the others, it's very clear. Really, you have to invest in technology. Technology will help you improve your processes, improve whatever your people are doing, and it's really something that we need to take into account. And then something that is typically overlooked as well, it's patient experience, how efficient we are, because even though usually we see the referring physicians as our clients, as the people who are sending us business. If the patient is not having a good experience, what we see is that the referring physician will hear about it, will hear from them, and then they will start, dwindling the volume of referrals that they are sending your way. So this is something that we need to keep in mind, because even though we don't see it, it's not as tangible or as visible for us. How we are understanding our level of patient experience is critical to maintain that strong referring pipeline. And now, what are some of the things that really impact this financial impact? Just to summarize, right, is revenue leakage. I already mentioned it could be due to a improper management of the denials, that you're not addressing some of the root cause, or just that you are not properly understanding your contracts to be able to bill the full amount, or just delays in reimbursement, again, due to potential issues with your patient access, or just the increased administrative costs that you may have due to manual processes. One of the key elements that we have seen is that if you're not optimizing some of your teams for order processing, scheduling, and insurance authorization, usually you tend to overstaff on those functions. And what we typically try to understand is what's the turnaround time for each of these interactions that we're trying to target, right? Are the orders, we need to process those orders in 24 hours, or are we trying to process those orders in 6 hours? That's going to depend on the relationship that we have with the referrings, and obviously what's the size of the team that we're comfortable with. But also understanding how long does each interaction or each individual order or appointment or authorization takes to process, and understanding doing that a proper analysis of that is critical for us to understand how many people we need on each individual function. And again, try to minimize the errors by specializing the workforce as much as possible. That leads to the better quality of their outcomes, but also you can find a really good balance between pooling and specialization, where you can use some type of mix of both, where you have dedicated people, but also a team of people that can float around multiple tasks, just so that you don't sacrifice too much utilization, but at the same time maintain the dedicated team that can increase the quality of the output. And I mentioned earlier that I was going to bring a very powerful case of how patient access can translate into significantly improving your revenue collection in revenue cycle management. And this is a real life case of a New York hospital, where when we came in, we saw that there were significant issues. As I mentioned, once we analyzed that ATV report, there were significant issues that were related to patient access that were impacting of the RCM team. And they were not able to process all of the denials in time. And this was affecting how much they were able to collect as as they were approaching that approaching filing submission date that we typically see, approaching filing submission timeline. Many of the accounts, many of the claims were approaching or outside that filing submission, and they were becoming less likely to collect. What we understood is that many of these reasons for denials, and what we see here, just to explain very briefly the charts, is the number of claims that were in each bucket is the size of the chart. And then here you see how impactful was the number of claims that they had, where they had issues across the board. And what you see here, whatever you see with the start, is something that was related to patient access reasons. For example, one of the things that we see most commonly, even though due to the size of the chart, it's not necessarily the amount here is not the most impactful, but in terms of just the sheer number of cases, is the largest by far, is information that it's needed for adjudication, meaning that you missed some information or the information wasn't accurate versus what the payer had. And that creates both the denials that you typically see, and again, that delay your cash flow, and that could become, an account that is a claim that is difficult to recover. But there are also others related to the no authorization process. And this might be due, again, to what I mentioned earlier, that you didn't allot enough time for your authorization team to be able to process that authorization, or that you may not have been aware that you needed an authorization for that particular procedure. And that's, again, very significant. And another one that we typically see that is related is that you got denied in the authorization. And this might be due to improperly submitting some of the requirements that for that authorization to be processed by the payer. So if you combine those, you see very, very clearly that the insurance authorization really becomes a huge issue for many providers. Again, this is a New York hospital, and not only radiology, but it's very well, they had as well some radiology components. And then last but not least, the medical necessity, right, which is as well related to how you're handling that insurance authorization component. And that might also be related to whatever you submitted during even the scheduling order processing steps in the process. So this is obviously a problem. And what we were able to observe is that just by implementing a few changes, not in the denials processing, but in the RCM, again, you can significantly improve all those claims that are collected in less than 90 days and improve significantly your cash flows. And this is by implementing a strong scheduling process implementing a strong insurance authorizations process, and implementing some technology tools that will really help. It all, from our view, it all starts with having the proper visibility, the right visibility into what these issues are. And it's due to this reason that we mentioned having that proper analysis, proper visibility into the ATB report, and then how you can communicate the RCM team and the patient access team to be able to address the root cause of the issue. Is it related to the insurance authorization not being processed in time? How can correct that? Is being related to the scheduling team not collecting the proper information? That, as we mentioned, is the most common case. How do we address that? And it's a collaboration efforts between those teams that will really yield the best results, in conjunction with some of the tools that we already alluded to as well. So what are some of the financial benefits that we see? It's not only what we already touched on, that you have faster cash flow recovery, lower days of sales outstanding, right? The faster collection of AR, and obviously lower denial rates, but it's also some intangible and tangible benefits that you see for improving those patient access steps, patient access process. What is the reduction in missed appointments? Just by having simple things like a very data-driven approach to patient reminders of their appointments can drive up the number of appointments that are actually performed, and that conversion from a appointment to actual exam, right? Having a data-driven approach, sometimes you need to, a bucket of patients, you need to remind them 2-3 days in advance. But for a bucket of patients, you need to remind them that a day in advance. Obviously, there are some things related to insurance authorization for you to be able to backfill that slot, but that can really improve how those patients start to show up more frequently at your center. I already touched on the high patient satisfaction level, but again, this is a key component of patient access and a key driver of patient access. If we don't have that in mind, then we'll probably, in the long run, in the medium to long run, we'll probably hurt our referral pipeline. And this is something that we try to avoid. The increased service utilization, and this means having that visibility of what I mentioned, really increases how we can deliver the service and how we can utilize better, as I mentioned, our high fixed cost asset. Better revenue retention, because when we're doing it better, especially with patient access, with patient experience, then that means that those referring physicians will be happier, and they will increase. To the contrary, if we have bad experience, if we have good experience, that means that we'll typically start sending us more volume, which is what we all want. And then there are some financial costs related to the administrative costs in patient access, which are related typically to having more people that you need, being overstaffed, which also puts a burden not only on your financial, but also on your recruitment team, on your management team that needs a bigger team just to process the volume that you're getting. And just, we wanted to give you a quick glance of what are some of the things that we typically see from patient access and how that translates into significantly affected RCM operations. And the main takeaway from what you see on your screen at the moment is that there's between 15 and 30% of potential revenue due to that is lost due to inefficiencies in the whole chain, right, of patient access and RCM. And again, one of the key takeaways is we need to look into patient access to be able to fix whatever is an issue with our RCM. Usually, when we have issues with the revenue recoverability and how we're collecting cash flows, we need to look no further than how we're processing the patient access components. How are those streamlined enough, and how much visibility RCM is providing to be able to correct some of the issues that are front-loaded, not necessarily back-loaded? We tend to look into RCM, but not look enough into how RCM is affected by patient access. And just to kind of summarize, what are some of the tools in the market that can really help? Even though we alluded to some of these, but having optimized scheduling through AI, there are a plethora of tools, new age tools that are really impacting how we're processing our patient access. Some of the ones that we've seen are the most impactful include how you can optimize scheduling. And this is not only having more time slots, it's also having the proper time slot available for that patient based on what's available. And it's a combination which you can optimize using some of these tools between the distance of the patient to the center, but also what's the lead time for that appointment that you're trying to schedule. And also that combination when, for example, we have a diagnostic mammogram that needs to include some breast ultrasound, how do you find the ideal time slot for those two exams to be performed together with the constraints that the patient is asking for, right? If the patient is asking that those two exams cannot be completed within more than a 4-hour time frame, then we need to take those into account. And these new age AI tools really help us drive and accommodate those type of constraints. Then there's the multilingual support, depending on your geography. This is something that you really need to touch on, which will really help improve patient communication, how you integrate with those healthcare platforms. And what we've seen is that many of these radiology information systems are getting more open to being able to adopt the open standards of communication and APIs that can really help all of the centers, the radiology groups, adopt these new age AI tools. And this translates into more adoption, which, in healthcare traditionally, in radiology groups traditionally, hasn't been as fast as it should. But with this new movement, we believe that it will happen sooner and faster. And then pay attention to how you are reducing abandoned call rates. What we've seen in the past is that typically the 22% of your abandoned calls, depending on your center and how strong your relationship is with the referent and your patients, but 22% on average won't come back on one call back to your center if they are an abandoned call, meaning that it hugely impacts whatever your a potential for revenue generation and appointment generation is going to be for your center. So pay attention to this as well. And there are many optimization tools that really can help you understand and address this issue. So I wanted to close with a few takeaways based on the presentation that you just saw. First, patient access is critical for radiology profitability. And we touched on many steps of the process that really impact, from order processing to appointment scheduling, and how these issues with collecting information at the scheduling point and also offering information at the scheduling point, like the insurance verification and benefits estimate, can really impact both what you collect from the payer and what you collect from whatever the out-of-pocket expense is for the patient, as well as obviously impacting many of these denials that you saw. Many of the buckets that we saw were impacted by patient access reasons. Some of the common challenges that we talked about: the AI and automation, as I mentioned, this is something that it's taking over in healthcare in general, but especially in radiology. We've seen a lot of appetite for adoption of these tools, which hasn't been the case in the past for healthcare. But this is different because obviously the impact that we are that these tools are having, but also the evolution of those frameworks for data integration and this data standardization that have been pushed since early 2000s that are really taking flight now. And then having a patient-centric approach, just because the patient is at the center of everything that we do and that you do at your center. So we need to keep that in mind whenever we're delivering the service. And what I would suggest after this webinar, it's inquire about those AI tools and how you can deploy them at your center. Do a deep analysis of that ATV report that you have to understand what are some of the sources that are related to patient access, and then communicate those to your patient access team so that they understand what to prioritize in terms of improving their patient access workflows, but also how to approach those improvements. We cannot solve everything day one. Rome wasn't built in one day. However, if you're able to understand, I have more of an issue with information collection, right? Either at the order processing point or at the appointment scheduling point. Then me as a patient access manager or director can understand then that I need to prioritize those workflows, again, collecting turnaround times and things like cycle times for all those interactions, and then understand how can I improve quality. Another thing that I would encourage everyone to understand is the sources of cancellations of exams. Again, I mentioned that close to 23% on average is related to insurance authorization issues. If you're above that benchmark, obviously it's something to pay attention to. But even if you're there, it's something that to keep in mind, because you can significantly lower the number of insurance authorizations that either come back denied or that you're not able to process in time and can lead to a cancellation. And the other is understanding what is your staffing requirement for across each function. It's understanding how can I serve the volume of interactions with an appropriate number of people so that I don't inflate my financial cost, but I also don't miss out on either an appointment or not being able to process a patient in time and they leave to another center. So those are some closing thoughts. Again, if you have any questions on what we explained, feel free to ask them now through the QA or the chat function, or just feel free to shoot us an email and we'll be more than happy to address any questions. So with that, I'll pass it back to you, Megan, if there are no questions that
Hey,
asked.
Edison, great job, and really strong actionable takeaways for our audience today. Thank you so much. We're not seeing anything at the moment popping in, but again, you guys will have access to this recording and this handout tomorrow. Should you have any additional questions, you can reach out to us at education@rbma.org. In addition, you can also reach out to Edison as well. Thank you for CCD Health for sponsoring this, and Edison, thank you again. This was great.
Thank you.
All right, everyone, have a great rest of your day. Bye-bye.